So this brings to conclusion our topic on preventive dentistry with special needs patients. Prevention in this population is a complicated thing. And as much as sometimes it's the aspect of dentistry that we think, oh, that's the hygienist's job, or that's just kind of a simple thing. Really managing prevention in this population is the most important thing that we can do for them. Because when it comes to trying to treat disease with this population, that gets, in some cases, impossible. And so the best thing we can do is really prevent. We've talked about trying to prevent caries. We've talked about things to do in the office with using fluorides to prevent caries. We've talked about being able to give people good advice on their diet choices and things to do with their diet to prevent caries. And we've talked about if there are small lesions on material choices and things to do to prevent recurrent caries as well. But the big topic we've talked about today is really about preventing periodontal disease and the issues that we'll face around that, both treating in the office and techniques to make sure that we do a good job treating when they come into our chairs, and how to help people at home do a better job. I want to stress that even today, that I'm recording this right now, within the last few minutes, we've had a patient come to Sparks that was coming in to get his teeth cleaned, and the chart has indicated in the past that, oh, he didn't have any calculus. And we really suspected, we wondered, is that real? And really instructed the resident, look carefully and let's look under the gum line. And guess what? Supragingivally on the teeth, there was no calculus. But subgingivally, there was extensive calculus everywhere, to the place that even had some mobility on some lower front teeth. This illustrates the problem that if we're not good at what we do with prevention and we don't take the time to really do a thorough job, sometimes we can hurt our patients and not give them the care that they deserve. Take prevention seriously. If we can prevent disease, we can make things so much better. One other thing that I will say about both in-office and at-home prevention, many of our patients aren't able to communicate discomfort very easily. If their gums are chronically inflamed, if they're not taking good care of their teeth, then the inflammation that can occur causes them a lot of pain, and they can become more combative, more difficult. We had a patient earlier today that, because of oral pain, was beginning to hit his face. He was an autistic patient, and the only way he knew how to communicate that his mouth was hurting was by hitting his face. His parents were telling us this, and that was their concern. And so in his case, it wasn't a hygiene issue, it was something else, but we've seen this happen with hygiene as well. And particularly with the shutdown from COVID and people not being able to get in, we've seen a lot more patients come to us in discomfort and pain and deteriorating behavior because they simply were not able to have their teeth cleaned as well as they needed. So think carefully about prevention. Think about the strategies you would use in your own office to make prevention work. And hopefully you'll have learned something from this lecture. Thank you guys for your attention. I hope that y'all have a good day.